Hello, my name is Simon Treacy and I'm based in St Vincent's University Hospital Dublin. My presentation is entitled Tracheostomy, Decannulation and Capping Trials, Do We Know Enough? A capping trial is a test to determine if a patient can breathe without the aid of a tracheostomy. It involves placing a cap over the tracheostomy with the cuff deflated to encourage airflow in order to aid phonation and laryngeal resensitization. Each year, up to 250,000 patients worldwide undergo tracheostomy procedures to facilitate weaning from mechanical ventilation. The process of weaning from a tracheostomy can be complex and is not without risks. For example, respiratory distress leading to death, with numerous variation in protocols for tracheostomy weaning and decannulation both locally and internationally. Consequently, even for experienced clinicians, this may become a challenging concept. The aim of our project was to assess the knowledge of Irish anesthesiology trainees in St Vincent's University Hospital Dublin in May 2025 regarding tracheostomy, decannulation and capping trials via an online survey before and after a focused teaching session. In terms of our methodology, an anonymous online survey was distributed amongst trainees before and after a focused teaching session. This teaching session was carried out by anesthesiology consultants, intensive care consultants, tracheostomy specialist nursing staff and speech and language therapists. Our results were then analysed to assess for improvements in the post-teaching survey in contrast to the pre-teaching survey. In regard to the pre-teaching survey, we had 14 participants. 78.6% of respondents had never received formal tracheostomy training in regard decannulation and capping trials. 14.3% of participants did not understand the purpose of a capping trial. There was no consensus agreement for the optimal duration of a capping trial. 71.4% of respondents could not correctly identify red flag features which would indicate a failed capping trial. 14.3% of participants were unable to recognise the clinical prerequisites that a clinician would like to have before commencing a capping trial or decannulation, and the majority of respondents could correctly identify equipment associated with tracheostomies. In regard to the post-teaching survey, we had 10 participants. All respondents found the session helpful and were interested in further tracheostomy teaching. 90% of participants understood the purpose of a capping trial. This is an improvement of 4.3%. There was no consensus agreement for the optimal duration of a capping trial. 40% of respondents could correctly identify the features which would constitute a failed capping trial. This is an improvement of 11.4%. 90% of respondents were able to recognise the clinical prerequisites that a clinician would like to have before commencing a capping trial or decannulation. This is an improvement of 4.3%. And again, the majority of respondents could correctly identify equipment associated with tracheostomies. In conclusion, our respondents overall scored higher in the post-teaching survey in contrast to the pre-teaching survey. The pre-teaching survey results suggest that maybe not enough emphasis is placed on this topic during Irish anesthesiology training, and this is important because education regarding tracheostomy management is vital so that junior clinicians know how to address these issues as they arise, which ensures patient safety and avoids complications.